Now I take this honor to give you a brief description about the Akola Association of Physiotherapists. It is the first local association of physiotherapists in the state of Maharashtra, founded in the year 2014. The idea was to form a group of qualified physios to work for the awareness of physiotherapy among the people and educate them to distinguish actual physiotherapists from quack practitioners and to provide ethical practice in Akola. Till date, there are total 26 registered physiotherapists in this group. It is noteworthy that due to the persistent efforts in the field, this association was awarded the best local association in the year 2017 at the National Conference of Physiotherapy held at Mumbai. The association has its own board of directors comprising Dr. Atul Kare sir. I welcome him on behalf of everyone. President, who did a master's in the musculoskeletal physiotherapy. We have the Vice President, Dr. Kiran Kadam. She is the first physiotherapist of Akola. Also Secretary, Dr. Darshan Laddaji. He has done his MPT in rehabilitation. And Treasurer, Dr. Amit Matre. I welcome you all for this interactive session. Now, I would like Nikita to take us further on this journey.
Thank you, Dr. Sanket. So talking about osteopathy, it is a very new field in India. However, it is full-grown profession in USA, Europe, Canada, and many more countries. Osteopathy has now come to India. The very first master's batch was first started in 2015 in Sri Sri University. So let's explore more about Sri Sri University. So I would request all of you to please watch a small video about SSU. We'll play a video in a minute.
We live in a world that is constantly of the world called Sri Sri University, their home.
If I had to point out that one thing that really makes me feel special about studying at SSU, it would be that synergy between the students, and that I think is the most special thing.
I'm sure that these students will make decisions in the near future that will change the world for the better.
I'm really happy to be here, and with every day I understand more how I appreciate this time.
Sri Sri University offers courses from an undergrad to a master's level and also PhDs. Sri Sri University is one of the first university in all of Asia to introduce osteopathy, a drug-free, non-invasive manual therapy that aims to bring a revolution in the path of medical science. Yoga, meditation and spiritual values are the foundations on which the university stands tall, and it is these that are shaping the personalities of our students inside out.
You know, there is no ragging happening, there is no one picking on each other, and that is really important, I feel. The environment of the university is such that the emotional quotient automatically develops in a person.
This is my 4th year in SSU, and I have seen a transformation on a very large scale in my life.
It gives you more than it promises, so that's all a person can ask for.
Sports is a way of life at Sri Sri University and is clearly exhibited in this vibrant campus and its students. The annual Fest Orion is a pursuit for brilliance. It is envisioned to be the biggest social celebration in Odisha and Eastern India, with the ambition of becoming the best annual fest in the world. Our alumni have been placed in some of the top multinationals while some have set forth to create successful startups of their own.
Srisha University was one place I looked at where I feel I could learn more than just what's in the books, because at the end of the day I realized it's a lot about handling people more than systems. It's about actually coming together and making a difference, and you don't find that so easily.
In 2018, Sri University was awarded the Best Bootcamp Startup Award by the Government of Odisha. Right from its year of inception, Sri University has been recognized with several other such awards. Our vision is to impart holistic and value-integrated education in order to develop visionary thinkers and leaders. The revolution in education has begun.
So that was at Sri University, the most beautiful campus I've ever seen. So moving on, let me take the privilege to introduce our guest speaker for today's webinar, Dr. Thiruvarangan Sigamani. Dr. Thiruvarangan Sigamani has completed his bachelor's in physiotherapy from Tamil Nadu, master's in cardiopulmonary physiotherapy from Delhi, MBA in hospital management from Tamil Nadu, master's in osteopathy from Sri University, Cuttack, Odisha. He has 18 years of academic, clinical, and administrative experience. He is a speaker in various national and international conferences. He is also a resource person for various seminars and workshops. Presently, Dr. Thiru is working in Sri University as an assistant professor in Department of Osteopathy. We welcome you, Dr. Thiru.
Thank you.
So before we begin, I would like to request everyone to put their questions down in the chat box, and it will be addressed by Dr. Thiru at the end of the webinar. So Dr. Thiru, the stage is yours. Please proceed.
Thank you, Dr. Nikita. Thank you, Dr. Sanket, for organizing this workshop and giving me the opportunity to meet my old bonds, reconnected it is. Thank you, Dr. Atul and team for giving this opportunity. It's more than a webinar, it is like an reconnection it is. Thank you for giving this opportunity. And I'm directly entering to the webinar because it is already 9:18. So whatever the questions we have, we can discuss at the end. If you want to put your questions, you can put it in the chat box. Otherwise, we can discuss at the end also. Okay, I'm starting. Recent days means in the last 2-3 years only we came to know about this terminology, isn't it? Osteopathy, osteopathic medicine. Frequently we are hearing this terminology. Before that we never ever. And even if we search in the internet, we are not getting the right definition of this, what it is osteopathy, osteopathic medicine. Long back, 15 years back, when he was referring one book, I think muscle energy technique, I think. And the author designation, it was mentioned as osteopath. And that time itself, I searched what it is actually, osteopath. I thought that's something related with orthopedics. And later on, the destiny for myself is now osteopathy. We'll come to know one by one what it is osteopathy, osteopathic medicine are both same or a different terminology. We have heard multiple streams of medicine, isn't it? Allopathy, modern medicine, Ayurveda, homeopathy, Siddha, Unani, different streams are there. Different countries, different systems of medicine. And what it is actually osteopathy? Is it a branch of medicine? Is it something like something holistic and a healing therapy like that? Some questions are always there. Some people think that osteopathy is an healing therapy, Reiki. It should be like Reiki, acupressure or acupuncture, touch therapy, prana therapy, marma therapy. Some people think there is a common misconception actually, but not at all. We have no relationship with any of these therapies. No relation, neither we study nor we practice any of these therapies actually. It is totally different. Then the question comes, is it an alternative medicine? Is it a complementary medicine? Or is it a traditional medicine? What the WHO says, that is most important. What you and me say more than that, what that international organization is saying, World Health Organization. It is saying that osteopathy itself is a system of medicine. The major difference between physiotherapy and osteopathy. Osteopathy itself is considered as a system of medicine. So like how allopathy is there, how Ayurveda is there, how Unani Siddha medicine is there, like that osteopathy itself is a separate system of medicine. So what kind of medicine it is? It is a system of manual medicine. We know already what it is, manual medicine is. Osteopathy is considered as a separate system of manual medicine. There is a common misconception. Osteo means bone, pathy means disease. Then it should be something related with the bone related problem. Then what is the difference between orthopedics? What is the difference between musculoskeletal physiotherapy and osteopathy? Actual meaning of osteo is looking inside. That is the actual meaning of osteo. And another meaning it is actually. It also means bone, which is a common meaning, but another meaning is looking inside. So whichever the problem, the health problem the body is developing, we should always look into the root pathology. Person is coming with a low back pain. We're going to treat a low back pain. Okay, spasm is there. But the question comes, what low back pain? So answer may be, it may be due to trauma, it may be due to disc problem, it may be due to fascial involvement. Then we are stopping there and we are treating them. This is the major thing. Just is it audible? There was some network issue. Nikita, is it audible?
Yes, sir. Yes, it is audible.
Okay, thank you. So we stop there. Okay, the person is having a disc problem, person is having a fascial involvement, spondylosis, listhesis, and we treat them. This is what we usually do in physiotherapy. What it is actually osteopathy. In osteopathy, what we do, we go into the deeper root cause. Why the disc problem? Why the listhesis? Why only that L5S1 is going for that? Why it is the L3 is going for? Why the disc problem is coming at that level, not in some other level? These are the questions that rise. Finding answer is through osteopathy, going deeper into the root cause. I'll give more example. So I'll touch a brief history about osteopathy. When it started, is it a recent medicine? Means definitely no. In US, it is considered to be a traditional medicine, traditional yet modern medicine. Dr. Andrew Taylor Still is the founder of osteopathy, founded 150 years back in US. He himself was a allopathy doctor, physician as well as surgeon. So he founded as such what it is actually now the osteopathy is. In the year 1874, imagine, it's not a new one. It's not something that new concept emerging somewhere in some corner of the world. No, not at all. 150 years back itself, it started its journey. Then it is still at first opened his school, American School of Osteopathy, in the year 1892. Since then, it started spreading slowly but steadily everywhere. So in the US, we have almost more than 34 schools are there in US alone about osteopathy. And from US, it started spreading to UK because of a student. It is still student. So mainly, this is Little John is the prominent personality in osteopathy. He opened in 1917 British School of Osteopathy. From Britain, it started spreading other part of Europe. Then after that, South America too, and even in Australia. Okay, but not in Asia. So Shishu University is the first university in entire Asia itself to open an osteopathy course, that to master's program directly. So what it is actually osteopathy or osteopathy medicine? Osteopathy is the terminology used all over the world. Osteopathic medicine is a terminology used only in USA, not anywhere else. So you should know the difference, what it is actually osteopathy or osteopathic medicine. We have a degree like MD and DO, isn't it? Doctorate in medicine and doctorate in osteopathy. That's the difference in US. So US, the curriculum is, everything is same. Medicine school, everything is same, except in addition to that, what they are reading as such in MD, they read osteopathic technique, manipulative technique to gain DO degree, doctorate in osteopathy. But in rest of all the world, for example, if you are taking Spain, if you are taking Argentina, South America, they are providing directly osteopathy without touching pharmacology as such. So what actually it is a non-invasive, it is a drug-free. We do not prescribe any medications. We do not cut and open the body, and we consider to be the one of the safest form of manual medicine. Manual medicine itself, remember this terminology, manual medicine itself, a question comes, is there any contraindications or side effects are there? Should there be any contraindication or side effect? It is a non-invasive. There is no question of side effect. We're not prescribing any medication, any chemical or any drug. So no question of side effect. That's why it is considered to be one of the safest form of medicine. We all know this, what actually the manual medicine is. What it is? The diagnosis and the treatment is through our hands. That is manual, isn't it? Through hands. That is actually the manual medicine. Treatment are also done by the manipulation or manual medicine. Diagnosis is done by physical examination. We have our own set of physical examination. So on what subject it is based? As I already told you, in US, it is all the subject from A to Z. Every subject is same as a medical degree. In addition to that, they teach osteopathic manipulative techniques. But in rest of all the world, if you are taking Europe or everywhere, all other subjects are same except pharmacology. Anyhow, through osteopathy, when a person is practicing osteopathy, they usually do not prescribe medication unless they have some other degree like MBBS. If they have some qualification on MBBS, then they start prescribing. If they have a basic qualification in Ayurveda, they prescribe Ayurvedic medications. So other than that, all the subjects are based on modern medicine. So anatomy, physiology, embryology, histology, biochemistry, biomechanics, pathology, clinical subjects, everything is based on modern medicine. We are studying as such a modern medicine. But at the end, the diagnosis and the treatment is through physical examination and hands-on technique. This is osteopathy. So how it is done? Usually in our clinical practice, we do not integrate. If we see medicine book, textbook, orthopedic book also, causes of etiology for low back pain. So still I remember 15 years back itself, the reasons were more than 40 reasons, 40 etiological factor behind it. And few causes are related with internal organ, few are related with the nervous system, few are related with the mental health too, isn't it? Stress can create low back pain, isn't it? That is how we have to integrate everything. So osteopathy, by a perfect manual medicine system, it is integrating musculoskeletal, visceral, as well as a neural system for the diagnosis and for treatment. This is actually what osteopathy is. Is it related with the patient-centered or a disease-centered? Means it is definitely related with the patient-centered. What the difference is actually? Giving an example, a person coming with an elbow pain, In osteopathy, not necessary that I have to treat directly elbow itself. I have to find out the root pathology at first. When I found the root pathology, it may be in cervical area too, it may be in a thoracic too, at the junction too. So if I'm treating naturally that area, the elbow pain can get disappeared. This is what the practical experience I have once. The person was so surprised that how come you are not even touched my elbow, but the pain has gone after the treatment. Because we found the root pathology. If a person is having an example, take knee pain, is it necessary that we have to focus only on the knee joint? Not at all. Problem is emerging at a knee area, but the root pathology is somewhere else, isn't it? So I'm giving an example here. This is how it is. So if I'm pulling my shirt here, see where the wrinkles are going, transferring. And if I keep on stretching, where the stretch will be, where the compression would be near to my lower costal. So where the problem initially I'll experience at the lower costal area, not here. The problem of constriction is happening here, but its effect is made here. So if I'm treating only at the lower costal area, it will be only temporary effect, not a permanent one. If I found the root pathology is here and I release this area without even touching this area, definitely it will give a permanent relief. That is actually the integrating these three systems in a patient-centered approach, not a disease. You come with 100 problem, you come with 100 symptom, don't worry. We will consider from top to bottom of the body. We will analyze, we will examine thoroughly, and after that we will treat whichever the root pathology is causing these symptoms. The root pathology can be one or many, but we will approach that irrespective of their symptom, isn't it? A spasm is sitting here. Why the spasm is sitting here? Question comes in the trapezius. Nowadays it is common in orthopedics also, no? Diagnosis means trapeziitis. I say diagnosis. So why it is setting in spasm in the trapezius? Question comes. Unless you touch that root pathology, you won't relieve this permanently. That is actually the patient-centered integrated approach, where we are directly involved in the analysis of root pathology, detecting the root pathology, root cause rather than only symptoms. We have 4 basic principles of osteopathy, that is unity of function. The body has the power to overcome the disease. We consider body as a one unit. We don't consider आजकल का क्या myofascial theory में एक important concept है, that is there is no more isolated muscle theory. ये मसल का नाम बाइसेप्स है, ये इसका नाम ब्रेकियोरेडियलिस है. अलग अलग नाम क्यों रखा है? क्योंकि फॉर आवर अंडरस्टैंडिंग ऑफ द बॉडी, isn't it? For anatomy, easier purpose. Okay, but is the body functions in the same way? Means definitely no. It is acting in a whole unit, not as an individual unit. This is now they have accepted because of myofascial theory. Even anatomists accept that. No, body definitely not. If a thorn is pricking our sole, is the only the foot is reacting to the problem, or the entire body? Entire body is going for a reaction. That's why body should be considered as a single unit. Whichever the pathology the body is developing, any kind of infection, inflammation, everything is inside the body. Naturally, we have that inside our body, isn't it? By anatomy and by physiology, we have everything inside. Only thing is, it has to efficiently work. If a structure is not okay, then function will also affect. If the function is not okay, it can affect the structure too. That is the interdependence of structure and function. And another important one is circulation is supreme. Circulation here means not only the arterial, it should be lymphatics too, and it should be the most supreme form of circulation, that is CSF, cerebrospinal fluid. We consider that as a supreme form of fluid in the body. So how the diagnosis and treatment, as I told you, it is done with our hands just by manipulating, palpating, perfect perception level. That is what actually the osteopathy is. And with that, are we treating only the physical problem? Definitely no. It is also including the mental health also, mental problem also. You take any mental problem, we treat that, means related with any structural dysfunction. And if it is, for example, if I'm giving an example, a college student came with a suicidal tendency few years back to me. This is a perfect example where a emotion is related with the structure. Suicidal tendency. He used to say that at Nagpur, that too. Nagpur, he came with a suicidal tendency, and I treated him. After that, he left a message. After 3 sessions, he left a message that I never ever felt such a calm mind in my entire life. Thank you for the treatment. I never ever felt. This is what his statement was. So, manual medicine is not only for the physical problem, it is for the mental health also. If a person is having too much of anxiety, anger, they are related with the organ, they are related with the tissues in the body, and we treat that. And what it is actually happening in autism, the question comes, isn't it? I'll answer for that. What are the major branches in osteopathy? If you are asking any classical osteopathy, classical means jo Purana technique as such, they are following it. They don't divide osteopathy into branches. Definitely not. This is what we are also following. We don't divide osteopathy into branches, but these branches are for the academic purpose, not for the clinical. If a person is entering into the clinic, for example, the same low back pain, and I'm finding where the problem is, and if the problem is the low back pain and the root pathology is organ, should I treat the organ or the symptom? I should go for naturally for the organ. Or sometimes the problem may be from some cranial involvement. So where I have to treat? I have to treat the cranial. Root pathology is the foremost important one to treat at first. So we always integrate these things. But for the academic purpose, we divided this into 3 branches. Musculoskeletal, that is otherwise called as structural osteopathy, where we learn many technique like muscle energy technique, myofascial technique, strain, counter strain, trigger point therapy, so many functional technique. So many techniques are there. Even HVLA, thrust technique is coming under musculoskeletal. What is visceral osteopathy? Treatment of internal organ. What are the organ we treat? Almost all the organ in the body. Everything. You take liver, stomach, pancreas, spleen, colon, ovaries, prostate, bladder, ureter, anything. Any organ you take, we treat that through manipulation. And the cranial osteopathy, what it is actually? Cranial osteopathy is related with, for an easier purpose, I'm explaining this as a neurological one. Related with the neurological, I can say. But it's not only neurological. An expert hand in a cranial osteopathy can cover these 2 branches without touching that part. That is this. My opinion is cranial osteopathy is the supreme form of osteopathy. We do not divide as such in the clinical practice, but the treatment accordingly, we decide that the problem, the root pathology, accordingly we treat with all these 3 branches. This is only for the academic purpose. Depending upon the patient population, which patient population is getting treated now, these are the emerging osteopathy branches, obstetric branch, pediatric one. There are some interesting stories behind these branches also. So we don't have that much time. Let me cover as much as possible. What are the side effect or complication? Naturally, definitely there is no side effect or complication. Why there is no complication or side effect? Because it is a non-invasive, it is drug-free form of medicine. So there is no question of side effect at all. Osteopathy is considered to be, in Western countries, it is considered to be one of the best form of preventive medicine too. In which conditions it can, many, it's not only for the pediatric condition. For example, I mentioned only the pediatric here, but not only for the pediatric, even for adult and geriatric also. We can prevent many physical and mental problems if the treatment is opted. That's why in our institute, in our university, we invite everyone for the treatment so that we can detect the problem earlier. So if it is detected earlier, they can prevent the future problem. This is the purpose of preventive medicine, isn't it? So in case if a child is born with some birth trauma, birth injury, we can definitely prevent for with a structural osteopathy point of view. Orthopedics may we have read about CTVS, isn't it? Congenital talipes equinovarus. Agar immediately after birth, if it is diagnosed and treated, we can prevent the future deformity, isn't it? The same here applicable for the neurologic problem also with the organ involvement also, everything. When it is applicable for the structural osteopathy, musculoskeletal osteopathy, naturally it is applicable for the cranial and visceral osteopathy. So even autism, attention deficit, memory problem, when the infants are, when the children are facing problem with the hearing, speech, memory, visual problems, anything, if it is detected earlier, treatment is highly effective. This is what actually the preventive medicine is. So what is the difference between osteopathy and modern medicine? It is not a branch of medicine, but it is based on a modern medicine. We are reading the same subject, what an allopathic doctor is studying everything. In addition to that, except the pharmacology part, in addition, we are reading the hand manipulation too. So if you are taking a Siddha medicine, the principle is maybe correlating with the Ayurveda, but the anatomy physiology, how they read is little different. It is not based on a modern medicine. If you are taking Unani, same it is applicable, isn't it? Even Ayurveda, recently they started including that modern anatomy and physiology, but as such the original one, they do not. They read it, they name it different. They read it in a different conception, but naturally it is same only. But osteopathy as such, since it is evolved from a modern medicine, so it is not a branch of medicine, but it is evolved from modern medicine as such. So major one, बहुत doubt होगा इसमें सबको क्या है in manual medicine. If you are saying a manual medicine, how different it is, osteopathy and physiotherapy. Legal point of view, if we are taking it, physiotherapy is considered to be a branch of medicine as per the council definition, but osteopathy is considered as a system of medicine, system of separate one, like how the allopathy, how Ayurveda, how Unani, how Siddha, same osteopathy also, separate system. Physiotherapy here, from a legal point of view, it is considered as a branch of medicine, modern medicine. So there are other things also, which I wanted to explain here. Focus of physiotherapy, we paid much attention to the musculoskeletal system and to the neurological system, isn't it? Neurological system and musculoskeletal system, not into the visceral. So visceral organ, internal organs are a major contributing factor for the health and disease. For a interesting curiosity tips, who developed actually, who is the I can't say as a father of visceral osteopathy, can't say, but he is the one who developed separately actually as a visceral osteopathy is Jean-Pierre Barral. He is a French osteopath. He was a physiotherapist initially, and if you want to have a quick look on his interview, it is available in YouTube. Only 15 minutes of interview. It's too interesting how he developed these techniques, visceral osteopathy. He himself was a physiotherapist, later on developed, he studied about osteopathy, and he developed this as a separate branch of osteopathy by manipulative techniques. Second one was a major difference. As I already told, in physiotherapy, we focus mainly on the physical problem and its rehabilitation. But in osteopathy, we focus on physical problem and mental problems, mental health. Combined one. We cannot separate it, isn't it? We never can separate it. If a person is having a physical problem, definitely there, for example, if a person is having some fractured leg, Do you think that we will be happy and jumping and celebrating with the party? Definitely no. Mental health is affected. If some person is having a mental problem, उनका चेहरा में पता चल जाता है with the face itself that how depressed they are, how sad they are, isn't it? Everything's body as a whole unit is reacting. उनका posture में भी पता चल जाता है. If you are reading physical examination in Maggie, it clearly says how the mental health is changing. Excuse me. How the mental health is changing the physical form of health. Even in Maggie, it is given. Excuse me. Long back, I was mentioning, long back, since the starting of my career, 18 years back, and one of my friend, Bonages, his name is, from Canada, he came that time to Delhi. He explained some concepts in tensegrity concept. And when we were asking questions, what are the equipments you have in your room? He said that, I know I don't have any equipment in my clinic. We were surprised that what, without any equipment you are running your clinic? Yes, everything is hands-on nowadays, and it will take time to reach India. That is what he said 18 years back. That is what it is now, the trend in physiotherapy itself. We are so much dependent on equipments. Now, if you are seeing an osteopathy clinic, what is our investment means? We don't purchase anything, any equipment, nothing. One treatment table, one stool, that's it. That's all the instrument. Everything else is with the hand. Whatever the equipment you have it. If you're taking TENS, if you're taking IFT, if you're taking ultrasound, short wave, whichever, then all these effects can be produced with your hands itself. So that's why it is called the end of era of modalities. It is ending actually. And it's the beginning of everything is the beginning of hands-on medicine. Everything can be treated. Everything can be treated and managed by hands-on. This is what it was in the previous century, isn't it? Later, and because of the entry of new scientific techniques, we changed a little bit, and now again we started following the same what it was and years back, decades back. And a few people have the doubt that what is osteopathy and chiropractic. Remember, osteopathy gave birth to many branches, many forms of hands-on technique, manual medicine. So osteopathy is the one that gave birth to the chiropractic too. It gave birth actually. Palmer, when he started developing, he studied osteopathy. Later on, he developed his own concept. He was interested much into the chiropractic, and he started his own school and he started spreading his knowledge. When Sutherland was more interested in cranial osteopathy, then he started developing more and more techniques and concepts in cranial osteopathy. And from Sutherland, Upledger was the one who developed a more simpler form of cranial osteopathy that is called as CST, craniosacral therapy. All are a form of osteopathy. When AT still founded osteopathy, he was practicing everything. In his history, it is mentioned clearly that he was practicing everything, all these things. Only name was not given. Later on, his students started developing. For example, if I'm saying, okay, I am specialized in cardiopulmonary, and they started developing, and in which I am specialized in intensive care unit, isn't it? Even in cranial osteopathy, cardiopulmonary physiotherapy, there are many super specialties, isn't it? Cardiac rehabilitation, obesity management, so and so, rehabilitation and all. But where I was trained clinically well oriented was intensive care management. This is how it was developed. Doesn't mean that intensive care physiotherapy management is totally different from cardiopulmonary or physiotherapy. They are all part and parcel of the basic physiotherapy itself, isn't it? The same applicable here, osteopathy and chiropractic. Now chiropractic is becoming a separate profession, and in some countries it is regulated. In some countries it is not. What is the international status of osteopathy? Osteopathy, well back, not in the year 2010, but well back, it was recognized by WHO, and it is considering osteopathy as a system of medicine. And it is coming under the traditional medicine, the older one, traditional medicine. And in 2010, WHO published a document, important milestone in the uh, osteopathic growth and development. They published a document for the training and the education of osteopathy. They set a certain benchmark. And for instance, if it has to be trained, if it has to be educated, what is the benchmark for an osteopathy? They have said this. This is an important milestone in the recognition of osteopathy itself. Before that, there were so many schools and colleges having their own guidelines, own recognition, everything. But later on, they also started following WHO guidelines. And in US, nearly 1.5 lakh osteopaths and students are there. And now it has increased. More than 34 active colleges are in US. And Europe alone, there are 54 osteopathy schools and colleges are there. Apart from that, as I told you, it is it is in Latin America too. And how it is regulated? Is it legal to practice? Yes, definitely it is legal to practice. Some of the countries I have mentioned here. So, for example, if you are taking UK, you can visit their website, General Osteopathic Council. So they are regulating through government itself. How the other professions are regulated, and osteopathy also regulated by the government itself. It is legal to practice after getting that license. So we are nearing end. What about osteopathy university? It is the first, as I told you, in Asia itself, not only in India, Asia itself, opening the master's program in osteopathy. In the year 2018, we started with a bachelor program. Now the bachelor students are entering the final year itself. So this syllabus and curriculum under masters as well as bachelors is purely based on the WHO set benchmarks. We are following that, how many credit clinical hours it is prescribing, we are following. That is most important when you are moving abroad. So how many students? Actually 99 students, undergraduate and postgraduate students, are pursuing osteopathy now. And what is our source of faculty members? We have national faculty. More than that, we have international faculty members from different countries like Spain, France, Netherlands, Denmark, UK, Argentina, and US. Different countries, they come here, they stay here for a month, and they teach our students. Usually they come in the winter season from October, November, December, January, February, March, in these 6 months, because they cannot tolerate the summer heat of India. So they come in these months and they teach our students the latest and new technique and new approaches in osteopathy, direct hands-on. Okay, thank you so much.